Hey there, Sam Visnick here, Release Muscle Therapy, and in this video I want to do a quick review of a product that I came across, and it's made by a company called Orchive. And for a number of years I've been looking for ways to reduce pressure on my hands. I've been at this for about 20 years now, and I do a lot of heavy soft tissue work, a lot of pressure into certain areas, and trying to save my hands is really a key component. So I haven't really been impressed with a lot of tools over time. I end up buying things and they don't really pan out, or I don't like using them. So I've tried things, and one of the things that I had come across, and I do want to do a review on this because I'm asked a lot on tools that I use, and this little gizmo actually is quite impressive and I've enjoyed using it a lot, so I wanted to do a quick review on it. So it is kind of a wonky looking thing, but the idea here is to actually reduce the amount of pressure that I would be using on my thumb, as that creates a lot of wear and tear, and of course I get a lot of fatigue in the connective tissues and in the joint on my thumb. And in particular, this has become a problem over time with treating the hip musculature because of how much downward force I need to press to get into some of those deeper tissues. Not so much in the lumbar spine, but it can happen. Also treating the hamstrings and sometimes the quadriceps. If I need to use that, most of the time I'm going to use my elbow for that, but there are times where I want to have much more precision, so I do favor my thumb. And the problem and the frustrating component with that is, of course, the strain on the thumb and also the fatigue. So this tool, I've had another type of tool which is called a thumbsaver, which is almost like a sleeve that goes over the thumb. Did not like it very much. It felt goofy, because it was really just something that slid over the thumb and I was trying to push down. It doesn't really reduce the pressure in this area. Okay, so this actually has solved that problem, which is pretty awesome. So it looks like it has a nice little grip here and you can hold on to that, and then your thumb goes in the little slot in there. Now, one complaint I would have, of course, with any tool like this is that it's really made for a standard size hand. Not sure how they determine that, but I have a fairly large hand. I'm 6'3", so as you can imagine, this is a little small for me, but it still gets the job done. Minor complaint. Now, the key feature on this is if I grab onto this grip and my thumb is here, of course my thumb is going to be supported with this component, but to add thumb pressure, I don't have to necessarily push down with my thumb. I can actually use my wrist movement to increase the downward force on the thumb. Now, this looks like a small thing, but makes a huge difference on your ability to actually get into the tissues without pushing directly down with the thumb musculature. So I can leverage, let's say I'm going to treat the gluteal area. Now, normally we would just push straight down with the thumb, but here I could actually deviate my wrist and push down, and that's going to increase the downward force on the thumb pressure area without directly utilizing pressure on the thumb itself. So this is hugely helpful, especially when I'm working into these tissues here. I can push straight down and almost leverage my body weight into that and apply, let's say, about 25 to 30% of the same effort I would be using just with my thumb by using the tool. So that is huge. So some of the areas that I like to treat with this obviously are leveraging that when we're getting into the hips. A lot of times when I'm first starting to treat tissues, I might use my thumb so I can feel my way around and get a sense for where everything is in terms of tenderness, but also how much pressure somebody might take. But after I go through that initial round, then I'll switch to the tool so that I can add more work into that area without fatigue. It is useful on the lumbar spine, especially if somebody has fairly thick and hypertrophied spinal extensors. Then we can use that for gliding activities in this area. Of course, I don't agree with using any kind of heavy pressure down into the lumbosacral region because it doesn't usually tolerate that. But at times where some of these tissues are quite thick and the hand can get tired and you want to do a sustained release for an area, then this can be helpful as well into that area. Okay? The other area where this tends to work really well is in the Tensor fasciae latae region, where again, it can be challenging to treat this muscle because of the corner that it's in. In the past, I've used a theracane to just lean into it, which is helpful, but it's also nice to have this as well, because as we put pressure into that section right there, obviously I'd be treating it on the same side. Then from this point here, I can just, again, deviate the wrist, and then add more pressure right into the TFL and start to do my gliding activities. Of course, could also use the opposite hand to push down as well, so that my wrist isn't doing so much of the work. So it can be leveraged a number of different ways. Now, the other area that I really like treating with this tool is the plantar surface of the foot. Now, a lot of different tools are too thin, right, which can actually have too much pressure in a small area. It's fairly uncomfortable, or an area, a tool is too wide and you're not going to get the directed pressure. This is a perfect tool for the bottom of the foot. And you'll see in some of my videos where I'm working on the plantar surface, one of the techniques that I'll use is to turn the tool sideways, and I will push with both thumbs and do my gliding on the way up. But certainly you can do one hand and do your glides. It works fantastic. So this is absolutely a phenomenal tool to have in your toolbox. Definitely will save your thumbs. And at this point, again, 20 years into my career, very, very important to be watching out for these things, to keep being able to do the work that I need to do and not put so much strain on these tissues. But if you're a therapist of any type, a massage therapist, rolfer, anything, I do recommend this tool. I have no affiliation to the company, but of course, I want to give recommendations to my fellow therapists for things that I think work really well. So as usual, what I'll do for convenience, I'll stick a link right below this video so that you have access to where to grab this, but I highly recommend it, and I hope it helps you in your therapeutic endeavors. Sam Visnick here, Release Muscle Therapy. Thanks for watching.